You're brushing your teeth when you spot something. A dark spot. Uh-oh, is it a cavity or just a stain? They might look similar, but cavities and stains are two very different dental issues. And knowing the difference can help you decide if it's time to call your dentist or just switch up your dental hygiene routine. Let's break it down. A cavity is tooth decay. It happens when acids wear down your tooth enamel and form a hole. A stain, on the other hand, affects only the surface of your teeth. Unlike other kinds of tooth discoloration, stains aren't a sign that anything's necessarily wrong with your teeth underneath. The causes are different too. Cavities are caused by plaque, sugar, and bacteria working together to damage your teeth. Stains are usually caused by things like coffee, tea, red wine, smoking, or certain medications. If left untreated, cavities can be painful, and they can lead to tooth infections, abscesses, or even tooth loss. They can affect your ability to eat, speak, and sleep comfortably. Stains don't cause physical harm, but they can affect your confidence and dull your smile. So what do you do about them? Cavities require professional care from a dentist. They can be treated with fillings, crowns, and root canals in severe cases. Most stains can be treated with whitening toothpaste, in-office cleanings, or professional bleaching. Prevention is key for both. To prevent cavities, brush twice a day with fluoride toothpaste, floss daily, limit sugar, and see your dentist regularly. To avoid stains, rinse your mouth after drinking coffee or wine, quit smoking, and keep up with cleanings. Whitening products can also help keep you smiling bright. Here's the bottom line. Cavities are a health concern, while stains are mostly cosmetic. Keeping up with consistent dental hygiene and regular dental visits is your best defense against both.